Hello friends, I am Dr. Subroto Pal, consultant gastroenterologist and liver specialist. With season's greetings on behalf of Palmet Specialty Clinic, today I am going to talk about a common problem of common people, that is non-alcoholic fatty liver disease. Fatty liver is a common problem to everybody. Normally there is some amount of fat present in the liver, but when there is excess accumulation of fat in the liver cells, then the functions of the liver may be impaired and liver becomes stiff, sometimes hardened, and in the long term it may land up into a severe liver dysfunctions and liver failure. So today we are going to talk about what is fatty liver, who are the persons who are more prone to develop fatty liver, how do you diagnose fatty liver, what are the management aspects of fatty liver, and what is the end results of fatty liver, that we will discuss in our topic. Normally there are two types of fatty liver. One is simple fatty liver and one is alcoholic fatty liver. Those persons who are used to take large amount of alcohol for long period of time, they are usually suffering from alcoholic fatty liver disease. But those who are not addicted to alcohol, but they can also suffer from accumulation of fat inside the liver, they are simple fatty liver. So these two entities, one is alcoholic fatty liver and another is simple fatty liver. These two fatty liver are main cause of liver dysfunction nowadays, apart from other causes of liver dysfunctions. So with accumulation of fat inside the liver, it triggers the inflammatory process. When there is excess accumulation of fat, it triggers inflammation, which is called hepatitis. So when there is accumulation of fat with inflammation in the liver, the entity is called steatohepatitis. It may be either alcoholic or non-alcoholic. So today's discussion is non-alcoholic steatohepatitis. So how do you diagnose steatohepatitis? Actually, the patients who are suffering from fatty liver do not have any significant symptoms. Sometimes, most of the times they are asymptomatic, but sometimes there is some fatigability, some dragging or discomfort in the right side of the upper abdomen, or sometimes mild pain. Apart from this, there is no such significant symptoms for which we can diagnose the patient is having fatty liver. Actually, the fatty liver is diagnosed by ultrasonography or other blood parameters when they are advised for some other causes for their treatment. So this fatty liver we can diagnose by blood parameters like transaminitis when there is elevated liver enzymes. Sometimes there is sonographic evidence of higher ecotextures in the liver, that can be, or other tests like liver biopsy. Sometimes liver biopsy is also required for diagnosis of fatty liver and its consequences. But liver biopsy sometimes, most of the time, is not advisable, but it is mainly used to exclude other causes of liver disease like autoimmune liver disease or viral liver disease or other rare causes of liver dysfunctions. So these two are the main parameters by which we can diagnose the presence of fatty liver and its consequences like hepatitis, fibrosis and liver cirrhosis. So what are the other alternatives for diagnosis of fatty liver and its consequences apart from liver biopsy is the fibroscan. This is one of the important instrument nowadays available in most of the centers, where we can assess the stiffness of the liver, that is when there is accumulation of fat along with inflammation for long period of time, there is fibrosis inside the liver, that is liver becomes hard, stiffened and sometimes rubbery in texture. So we can assess the stiffness of the liver by fibroscan evaluation. So these are the techniques by which we can assess the presence of fatty liver, its progression and its consequences. So when we should when we can assess a patient, or we can suspect the patient is having fatty liver, who are the persons who are more prone to develop non-alcoholic fatty liver disease? This is one important points that we have to kept in mind when we are dealing with several patients. So patients who are obese, patients who are having diabetes, sometimes they are dyslipidemic, and other comorbid conditions like cardiac conditions, ischemic cardiac disease, and sometimes evidence of family history of liver cirrhosis, family history of ischemic heart disease or coronary artery disease. These are the conditions where we can suspect the patient might have suffering from fatty liver and its consequences. So these group of patients, we should be careful about evaluation of his blood parameters like liver function test, ultrasonographic examinations, and sometimes fibroscan before jumping into the process of liver biopsy. So how to tackle this fatty liver? There is no specific medications available nowadays for managing fatty liver, but lifestyle modifications, dietary modifications, exercise is the mainstay of therapy, of which weight reduction is one of the important aspects to advise for the patients who are overweight or obese. Apart from obesity, the control of diabetic status, control of dyslipidemic status are also very much important to tackle fatty liver, because non-alcoholic fatty liver disease is a conditions which we can call it as metabolic syndrome, part of the metabolic syndrome, where diabetes, dyslipidemia, hypertension, hypothyroidism, insulin resistance, all these come into one basket, of which one member is non-alcoholic fatty liver disease. So we have to tackle each and every point, every entity, and then we should formulate our treatment schedule as and when required. So apart from lifestyle modifications, dietary modifications is also very important. Diet means there should be hypocaloric diet, because less amount of calorie intake reduces the fat, reduces the energy available inside the liver. So hypocaloric diet, low carbohydrate diet, avoidance of saturated fats, saturated sugars is very important for dietary advice. And lots of vegetables, lots of fibers and fruits are also very much important role to play for managing fatty liver disease. Apart from this, there is very few medicines are available nowadays for fatty liver. Actually, there is no such medicines which can reduce the fat content of the liver, but we can reduce the liver fat by doing rigorous exercise with reducing weight. At least 10% of his body weight over a period of 6 months of time is very much helpful for reducing the liver fat. But it is very difficult for a person's to reduce 10% of body weight over a period of 6 months, but 5 to 7% reduction of body weight can be very much helpful for reducing the liver fat as well as controlling the other comorbid conditions like diabetes, dyslipidemia and hypertension. So apart from this, there is some medicines are also available which reduces some inflammation and fibrosis status of the liver, like fenofibrates, like saroglitazars, and recently introduced obeticholic acids, which are on trial for the management of fatty liver and its consequences. So with all these factors, we are managing fatty liver, as it is not a disease, it is a condition, it is a state of health where multiple factors come into play for production of this fatty liver. And when we treat this fatty liver, it can be the liver fat, liver fibrosis, we can reduce it and we can control and we can prevent the further progression of fatty liver and its consequences like liver fibrosis, liver cirrhosis and its consequences like liver hepatocellular carcinoma, decompensation, all these things which are very end stage liver disease. But most of the fatty liver do not require any invasive treatment. Only dietary modifications, exercise and management of the comorbid or associated conditions is helpful for managing this disease. So thank you. If we are discussing this non-alcoholic fatty liver disease in a very short period of time, but thank you for watching.